And the second speaker for today is Lisa Ashton from WACE, who will talk about the Family Violence and Disability Practice Leader Program. So welcome, Lisa.
Thank you, Melissa. I'm very happy to be here. I do have a quick presentation to show you guys. So I'll just bring that up. Just bear with me. So my name is Lisa Ashton. As Melissa said, I work for WACE in the Southern Melbourne catchment area, and I am a family violence and disability practice leader. So today I will just be touching on the Family Violence and Disability Practice Leader Initiative, as well as giving a quick little introduction to family violence, disability-specific family violence, recognising the signs of family violence, and then some referral pathways. Before I get going, I would like to acknowledge the traditional custodians of the land on which we meet. So for me today, I'm coming to you from the Bunurong people of the Kulin Nation. I would like to extend my recognition to elders past, present and emerging, and note that sovereignty has never been ceded. I also need to preface this that I am speaking about family violence. It can be quite a triggering conversation. It can be quite confronting. So please, if you need to step out, feel free to do so. 1 in 4 people does experience family violence. So it's very likely that people in the room today have lived or living experiences. So please make sure that you look after yourself and take time. And if you need to step away, please do that. And I would also like to say that I am talking about victim survivors as females and as perpetrators as males, and that's because of the gendered nature of family violence. So we do recognise that there are male victim survivors and there are female perpetrators, but overwhelmingly the majority of perpetrators are male and the majority of victims are female. So for those of you who aren't aware of WACE, we are funded by the department to cover the City of Dandenong, City of Casey and City of Cardinia. And we provide homelessness and housing services, so crisis accommodation, support to get rental properties, rental arrears, those sorts of things, as well as a suite of family violence programs. We do case management, we do intake and assessment, we have practitioners that sit with Victoria Police, we have practitioners that sit with child protection, maternal child health nurse, and then we have a portfolio of practice lead positions, which is mine. So trying to bring a family violence lens across various different scenarios where people might be accessing mainstream services. In terms of the Family Violence and Disability Practice Leader Initiative, this is a relatively new initiative. It was funded by Family Safety Victoria, which is the government, and it's in partnership with Safe and Equal, so the peak family violence body in Victoria, Women with Disabilities Victoria and Sexual Assault Services Victoria, and it's in response to the fact that we know that people with disability experience violence at much, much higher rates than those without. However, they're not accessing mainstream service systems. So I guess part of the role is to provide support to family violence and sexual assault practitioners working with clients with a disability to apply a disability lens to the work that they do to try and break down some of the barriers that they might be experiencing, and to make sure that we are ensuring the voice of the person with the disability is heard, that we're not making assumptions about what they're, about what's best for them. And it's also working with the disability sector to make sure that you are comfortable in recognising family violence, responding to it, are aware of referral pathways. And we do this support through secondary consultations, through capacity building, coming to meetings like this today, and just sharing, I guess, our role and some of our knowledge in this space. So there are 8 of us in Victoria, and we cover different catchment areas. We have 3 within metropolitan Melbourne, and then the remaining 5 are within regional Victoria. And then we have at Safe and Equal the disability liaison officer who's able to provide secondary consultation as well. So we do cover the whole state. We might not be able to specialise in specific areas if we don't have the practice leader within that area, but we are always available to provide our knowledge and our guidance. So please reach out. At the end of the slide, I do have all of our contact details there as well. So what is family violence? It is any violent, threatening, coercive or controlling behaviour that occurs between people within a family or family-like relationship, or between current or previous intimate partners that cause the person experiencing that behaviour to feel fear. And that feeling of fear is really, really important when we're looking at family violence because people argue. However, it's when you are fearful of those behaviours, the intimidation, the coercion, the manipulation, and that's creating that fear that it becomes family violence. It's also really important to note that the definition of a family-like relationship, when we're looking at people with disability, it includes carers, it includes support workers, it includes people if you're living in a group home, you might consider the other people in the group home to be your family-like members. So anybody that is within your inner social circle and is, that is very, very important to you falls within the definition of family violence. Now, there are various forms of family violence. It's physical violence, emotional, psychological, technology facilitated, sexual abuse, all of those sorts of things, which I will touch on in just a moment. But it is worth noting that women and girls with disability experience violence at more than double the rate of those without disability. 65% of women with disability have experienced family violence since the age of 15, and that's compared to 15% without disability. Women with disability are more likely to experience sexual violence, more likely to have children removed from child protection, and those with cognitive or intellectual disability are more than 3 times more likely to experience violence than those with a physical impairment. So really high rates of violence, which is just unacceptable within the systems that we work in. Any form of violence is not okay. When we look at family violence and the intersect of disability, we know, unfortunately, that sometimes a disability can be weaponized against the victim survivor. So there are sometimes specific tactics that a perpetrator might use to use the disability against the victim survivor. It may include restricting access to services, so that could be your GP, advocacy services, NDIS services, any cancellation of specialist appointments. So really trying to access or to control the specialist disability services that are required there to support. Disability-related financial abuse would include things like misappropriating NDIS funds, taking carers payments when they're not entitled to carers payments, withholding payments, not buying medication when they have been asked to buy medication and they have the means to buy that medication for the person with disability. Abusing any of power attorney arrangements that might be in place, and just really trying to control the finances to limit the autonomy of the person with disability. In terms of medical abuse, it might be the over or under prescribing of medication. It might be withholding medication, or it might be forcing somebody to take medication when they're not, when that kind of medication isn't actually prescribed to them. Physical abuse, this is something that we see really, really frequently within the family violence space. Restricting somebody's ability to move around. So locking them into rooms, locking them onto chairs, harming service animals or threatening to harm service animals also fits within the physical element of family violence. Or if you're somebody with a physical impairment and you rely on the perpetrator to, say, run a bath for you, and they're deliberately making that bath either scalding hot or freezing cold, and they put you into that bathtub and you depend on them to get you in and to get you out. So they're the sorts of things that we would be thinking of when we're talking about physical violence. Reproductive coercion, forced abortion, forced pregnancy, forced sterilisation. Unfortunately, in Australia, this is something that still happens all too frequently. In 2022, there were at least 9 women who were sterilised against their wishes. And also within the reproductive coercion with withholding or forcing contraception on the victim survivor as well. Psychological abuse might include social isolation, the threats to involve child protection, the threats to withdraw services, sharing confidential information, putting somebody down and really minimizing the disability, calling them crazy, calling them bipolar, denying that the disability exists would all fit within the realms of psychological abuse. Restrictive practices might be things like removing wheels from wheelchairs so the victim survivor isn't able to move about freely, obstructing hallways, moving items around the house. So if it's a vision impaired victim survivor and things need to be in specific places and the perpetrator is deliberately manipulating that situation to cause hazards, to make her scared and not know what's there, what's not there. Locking somebody into or out of rooms as well would fit within restrictive practices. And then in terms of sexual abuse, the unwanted touching by caregivers, the demands for sex for exchange for services, or the control of reproductive processes. When we talk about family violence and the intersect of disability, we also need to talk about disability as a result of family violence. So family violence is the leading cause of serious injury, disability and death in young women aged over the age of 15. There was a study, a 10-year study done in Victorian emergency departments of hospitals that found that of all family violence presentations, at least 40% of women had a traumatic brain injury as a result of their family violence experiences. Now, that number is thought to be much, much higher because, unfortunately, many women don't actually seek medical advice after instances of family violence. But when we're looking at disability as a result of family violence, brain injuries, we know that more traumatic brain injuries are likely to cause dementia later in life. There's a lot of work and study being done at the moment into what that journey might look like. So, I think that will be a really interesting space to watch as well. Psychosocial disabilities, so complex PTSD, anxiety, depression, insomnia, chronic pains, higher stress, those sorts of things. There's also obviously the risk of physical impairment, so quadriplegia, paraplegia after serious assaults. And we also would have women that are having their sensory developing a sensory disability as a result. So they might lose their vision as a result of a physical assault. There might be significant damage done to eardrums, resulting in a hearing impairment. So it is really important to recognise that disability can be used as a specific tactic of perpetration of family violence, but also that disability can result from family violence experiences. In terms of family violence warning signs and indicators, if you are working with somebody that you suspect might be experiencing family violence, typically we will exhibit some kind of change in behaviours. Those sorts of things will be trouble concentrating, unexplained outbursts or aggression. In younger children, it might look like regression or acting out. It might look like changes in the level of confidence, somebody not being able to make a decision for themselves anymore, saying, I have to check with this person to make sure that that's okay. In younger people, it might be that there's bedwetting, that people are becoming very, very secretive, that there's the inability to regulate emotions. Changes to social patterns and friendship groups. So typically that's the withdrawal of from those social groups. So becoming very, very isolated, becoming disengaged, or becoming quite angry and aggressive to the social circles that do exist. It might be that changes to support have occurred. So the perpetrator might be wanting to attend all of the appointments. They might be cancelling their appointments, which is really unusual for them, and without giving any justification as to why that might be happening. Or if the perpetrator is attending those appointments, they're not allowing the victim survivor to speak on behalf of themselves. There might be the constant checking in, phone calls, SMS, constant checking in. Where are you? What are you doing when you are in those appointments? And there's obviously the physical symptoms, so the body's reaction to family violence. That's the feeling of being physically sick, nauseous, anxious, stomach aches, sudden weight loss, sudden weight gain, headaches, self-harm. Those sorts of things are also really prominent. Obviously, if you're working with somebody that typically has some medical aids or supports and they're no longer available to them, that is a red flag. The unexplained bruises, cuts, swelling, those sorts of things, the physical, visible injuries, without any rational explanation as to how they might have come about. No access to finances. They don't have their bank cards. They have to ask for permission to spend money. They're unable to withdraw their own money. And then obviously if the person is feeling really worried, really anxious or fearful, that's also an indicator of family violence occurring. In terms of referral pathways, so obviously if you do suspect that somebody is experiencing family violence, you want to check in on their immediate safety, and Victoria Police 000 would be the first port of call. And then the orange door is the Victorian statewide intake service. Casa House is a sexual assault and family violence counselling service, as is 1-800-RESPECT. Safe Steps is the Victorian crisis response, so for whenever victim survivors are no longer safe to remain in their home and they're needing crisis accommodation out of the area. So that would be the port of call when they're in immediate danger and need to flee. And then In Touch as well are a family violence service that provide a specialist lens for people of culturally and linguistically diverse backgrounds. In terms of the Family Violence and Disability Practice Leader Initiative, secondary consultations, what do? We provide tools, resources, information, engagement strategies. How do you have that conversation with somebody that you're supporting when you suspect that there's family violence present? You think that you think that some of those indicators are there, what does that conversation look like? What are the referral pathways? What information can we be providing that person? So having those sorts of conversations, talking about what supports are in place. It is really important to note that we can provide secondary consultation around any person within the family unit that has a disability. So it might be the victim survivor has a disability, it might be that the children within the home have a disability, or it might be that the perpetrator has a disability. All of the practice leaders bring different experience. We have different backgrounds and specialities, but we do provide secondary consultation for anybody within the family where there is the intersect of family violence and disability. If you are supporting somebody and you suspect that there is family violence there or sexual assault there, then I would strongly encourage you to reach out for a secondary consult. So these are all of the details of the different practice leaders across Victoria, and more than happy for the slides to be distributed afterwards and disseminated amongst the team. Damien does have a copy of that. So strongly encourage you guys to reach out if you are supporting anybody or if you have any questions. If you're interested in any capacity building or information sessions as well, we'd be able to support with that. And that brings me to the end of the presentation. Just a really, really quick one, a very brief introduction to family violence and disability and the intersection. So thank you. And are there any questions?
Thank you very much, Lisa. It's really useful to know more about the It's really useful to know more about the referral pathways, and it's good to have another angle, an avenue of complaint resolution through the family violence sector as well, not just through that disability space too. So I'll open up the floor if there's any questions. And yes, all the PowerPoints and everything will be circulated after this session, so you'll still be able to access all those really useful contacts that were on the slide before. But if there's no further questions, Damien?
There's a question in the chat.
Yes.
Question in the chat from Ronnie from Star Victoria.
Can you read it out for me?
Sure, yes. When contacting Safe Steps Disability Department to refer a client, I was told there were no programs or support for people with disabilities as funding was cut. I guess it's more of a comment, but also a general statement.
I would, if you're experiencing those sorts of barriers, I would reach out to the practice leader in the area that your client is residing, because we can do advocacy with Safe Steps. They may have had a reduction of funding, but they definitely haven't had a complete cut of funding. And sometimes we need to advocate for somebody in really, really specific terminology with that family violence lens that people from other sectors may not necessarily have that area of speciality. So if you are experiencing any of those barriers to accessing services, I would strongly encourage reaching out for a chat, and we can escalate things as well.
Beautiful. Great. Any other questions before we close up for the day? No. Well, thank you very much, Lisa. That was really, really useful, and it's a really, really great resource for us to be able to assist advocates into understanding what those pathways are for family violence clients. So really, really appreciate your time today.
Thanks.